first question is, all of the following are properties of ventricular muscle fibers. Now, what about the all or none law? Remember, the cardiomyocyte, they do have gap junctions which are made up of connexin protein, remember? And because of that, they act as a syncytium, isn't it? So definitely, yes, it follows the all or none law. Single muscle fiber, single nerve fiber, and the smooth muscles or the cardiac muscle, which is having the gap junction, these three things are going to follow the all or none law. So that is true. What about the length tension relationship? Remember the heterometric regulation of cardiac output? That was your Frank-Starling law. You give more input, you're going to get the more output, but it should be in the physiological limit. Within the physiological limit, you increase the initial length of the muscle, the more will be the force of contraction. That is nothing but if you increase the venous return, the EDV, that is your end diastolic volume, is going to increase, which is going to increase the troponin C sensitivity and the actin-myosin cross bridges, and because of that, stroke volume will increase. Input is directly proportional to the output. That is nothing but your Frank-Starling law. So yes, that is nothing but your length tension relationship also is there in the cardiomyocyte. Length is nothing but the initial length, which is decided by the EDV, and tension is nothing but the force of contraction, because of which the stroke volume is decided. Then, what about tetanus? Remember, the cardiomyocyte ka action potential, if you remember that it has the 4 phases, actually 5, 0 to 4, right? So because this is the you can say phase 2, that is nothing but the plateau is very, very long, and because of that, the absolute refractory period is also longer, and because of that, the sustained contraction is not possible. That means the tetanus is not possible in the cardiomyocyte. So definitely, because of the long refractory period, that is not possible. So yes, long refractory period is the property, but tetanus is not possible in the cardiomyocyte. So the answer is going to be 1, 2 and 4. 1, 2 and 4.